Welcome to this interview. I am delighted to be here with Dr. Kyle Ganson. He's a researcher and assistant professor at the University of Toronto. And this webcast is part of our series on eating disorders. Kyle, it's really great to have you on. Thanks so much.
Yeah, thanks for having me. I'm really excited to be here.
Kyle, it is probably common to think that eating disorders such as bulimia or anorexia nervosa, binge eating, and so on are predominantly affecting women. There's been not so much research into disordered eating among men. What has your research into disordered eating among adolescent males uncovered?
I think it's a very big misunderstanding that eating disorders, and when I use that term, I often am kind of qualifying that as the sort of main eating disorders like anorexia or bulimia or binge eating disorder, that those three main disorders don't affect men or boys. But what we know is that certainly boys and men make up roughly around like 20 to 30% of the people who actually do experience these issues. And in some cases, like for binge eating disorder, for example, are actually somewhat on par with the rates of among women and girls. So certainly not very well researched and not very well understood within the general public around who experiences eating disorders. There's a lot of stereotypes around that. And so that's definitely a big misunderstanding. And some of the research that I've done is looking specifically at some of the unique behaviors that boys and men engage in that are kind of underneath the categories of eating disorders or disordered eating behaviors. And much of that is focused on different attempts to achieve the male body ideal, which predominantly focuses on increasing muscle mass and lean muscularity, sort of that. Maybe The Rock is a little bit of a characterization of that. I mean, he's quite a large figure and very muscular, very lean. But even someone, I often use these examples like Cristiano Ronaldo, very lean, very athletic, very muscular, very cut. He's also, I use The Rock and Cristiano Ronaldo very commonly because they're like the 2 or 3 most followed people on Instagram. And so there's people who are viewing their bodies very, very often. And they often post things of their bodies for their followers. So, those are kind of the ideals that a lot of males, boys and men are seeking to achieve. And so the behaviors that they engage in are aimed at that. So it could be excessive exercise through weightlifting. It could be like performance enhancing drugs or appearance and performance enhancing drugs like creatine and whey protein and steroids. And either other things, like there's a couple new ones like SARMs and terkesterone is another one that's coming out. It's becoming a little bit more common again. So, substances that are not very well regulated and could be quite problematic and dangerous for some people. So the research that I do really tries to focus on those specific behaviors. And I think one of the reasons why boys and men don't necessarily get captured underneath the sort of traditional eating disorders is because they just look a little bit different. And a lot of the research that has been done and the treatment that's been done around assessment and intervention around eating disorders has predominantly focused on women. So we don't always know exactly what to do when a boy or a male or a man comes to the room and says, I'm doing these things. Or clinicians just kind of miss it at large because they're just not really thinking to ask the questions or see it as potentially problematic or driven by some sort of body image issue or motion regulation issue or low self-esteem, like again, driven by maybe more like problematic components of one's life versus more, positive engagement or healthful engagement in exercise, for example, or even moderate use of some of the dietary supplements that generally can be safe if done correctly and monitored, but need to be keeping that stuff in consideration. So there's multiple aspects of why there's some misconceptions around why boys and men don't experience these things, and a lot of that has to do with because we're not maybe asking the right questions to get the answers we might need to know.
Great. And following these increases of the use of appearance and performance enhancing drugs and substances, in your view, what action should be taken either as a prevention or maybe as an intervention? And do you perhaps, because you mentioned there the practitioners, also have some advice to more practical advice to practitioners?
So I think that recently I've had a few papers published with some colleagues looking specifically at what are called APEDs, appearance and performance enhancing drugs and substances. And those generally include things like Like I said, like whey protein, creatine, steroids, so any diuretics, things that are meant like substances, many of which you can buy like quote unquote over the counter or legally from a pharmacy or a nutrition store. So they're actually quite commonly used, and even steroids on a global scale is actually rising in some prevalence. So even though they're illegal in many countries, there is a lot of use still, surprising use. And so the research that I've done has looked at sort of behavioral and social and behavioral correlates or associations with those substances. So, for example, we found associations between like sexual risk behaviors, like having a greater number of one-time sexual partners of people who use these different supplements, including, legal supplements and illegal supplements. We've shown some examples around, alcohol use behaviors and engagement in some of these supplements and substances. And even eating disorders, of course, a recent study found in college students showing that if you use these supplements, that you're more likely to have some risk for eating disorder pathology. So certainly it's like some risks associated with them. Again, they're not necessarily causal. It doesn't mean that you use them, you're therefore going to have these issues, but there's connections between these different behaviors that we need to be aware of. So what we should do about that is, number one, we need to have more research. We need to really truly understand like how common it is in the population. What are the patterns of use of these supplements and substances? How do people actually learn about them and initiate their use? How do they gather information about what's safe and what's not safe, and how to actually use them, where to buy them? We need to really understand like what is in fact problematic use, and I'll put that in quotation marks, versus not. Because just because somebody uses whey protein doesn't mean that they're going to go on and have a bad outcome, right? Or engage in some sort of social or behavioral problem. But there are people who do, and so we need to figure out what is the line between what's problematic versus not, and how we differentiate that. And then, of course, we need to figure out like treatment approaches. So once we've identified whether or not something is or isn't problematic, if it is problematic, if it does create some issues, what type of intervention approach do we actually need to take? Is it sort of rooted in eating disorder behavior and eating disorder treatment, where it's focused on thoughts and body image and things of that nature? Or is it more focused on like substance use treatment, like motivational interviewing? So we really need to understand like, is it problematic or not? If it is, how do we actually treat it? And that, of course, requires research. And obviously, it's quite challenging to do that research if we haven't really characterized the sort of problem itself. And then I think, similar to what I said previously around like initiation and how do people actually engage in these behaviors? Where do they learn about it? Where do they gather the information? Certainly those, that type of information would help us, with certain public policies and sort of systemic ways in which we can maybe curtail the use, or even just provide more information. There's several states in the United States that are passing laws and legislation, or trying to pass laws and legislation around restricting the sale like legal supplements to young people, so like those who are under 18, and included in a lot of those bills is like providing more information that like they're not research tested for purity or for effect, even though it says it's going to help you build your muscle. Like that's actually not a research outcome that's been really done, right, and proven. So a lot of like more policies could help with that. And I think in general, the sort of systems around these APEDs, again, particularly the legal ones like whey protein and creatine, they're not well regulated. So it requires, especially in the States and here in Canada, like it requires the individual, if you have an adverse event, maybe say for some reason you get sick or there's some toxin that happens, you have to go to the emergency room, whatever, go see your doctor. It's on you or on that person to then report that adverse event. So there's not a lot of preliminary research like they do for pharmaceuticals that say, these are safe, these are pure, these have intended effects, even though, as they intended are they're supposed to. And so there's just a lot of lack of regulation. So all these things, so understanding, I'm linking it all back together, understanding prevalence, understanding how people engage in these behaviors, understanding what's problematic versus not, all that would lead to all different types of important prevention and intervention efforts, like systemic policy changes, like actual research around how do we treat these issues, like prevention efforts in schools and other public health settings like primary care and doctors' offices about how do we educate people who are engaging in them to address the problem or curtail the problem on a larger scale. And then I think specifically like clinicians, what they can do, I often tell people that you have to gather the information just like you would anything else. So curiosity is very important. I'm a clinical social worker by training, so I work I've worked in clinical settings with people for a very long time with eating disorders and various body image issues. And if you don't ask the questions, if you're not curious about why someone might be using whey protein or going to the gym 7 days a week for, 3 hours, or, engaging in bulking and cutting cycles or whatever it might be, we have to really be curious about why people are doing that. And if it's for the purpose of trying to attain this specific body ideal or interferes with their social functioning, I think it's important to sort of dig deeper and really understand the context of that behavior and that thought process. And then, of course, try your best to engage in maybe positive behavioral change or even awareness of this could be a potential problem or whatever it might be for that individual.
You also looked at how eating disorders are associated with other behaviors among adolescents, for example, vaping and e-cigarette usage and non-suicidal self-injury and also suicidal behaviors. What did you find there, and what are your recommendations following that work?
Sort of my caveat for a lot of that research is that it's, a lot of my work is done around college students and students, people who are enrolled in college, primarily because a lot of that data is accessible. It's large data sets. And so it's kind of easy to have questions that need to be answered through data that can be done quite well. So they're not always 100% generalizable, of course, like the greater public. But that being said, there's trends there, of course. There's things that we should be thinking about that likely are sort of happening outside of college settings, for example. So, for the multiple studies you referenced, the research around vaping sort of showed that people who engage in some sort of vaping or e-cigarette use were more likely to not only have an eating disorder diagnosis, so actually in their lifetime have been diagnosed by a professional that they had anorexia or bulimia or binge eating disorder, but also actually were at higher risk too. So even those people who weren't diagnosed with an eating disorder, people who were vaping were more likely to screen positive on a screening tool for eating disorder. And what that means is, that doesn't mean that they have an eating disorder. It means that it's likely that they are engaging in behaviors that are disordered eating in nature or have some body image concerns, which then would require some more further follow-up or further assistance. And so yeah, there's a link between those substances. And some of the other research has focused on that as well, around vaping and eating disorders, kind of indicate some particular mechanisms. Like, of course, vapes can be flavored. And so there may be some need to sort of satisfy some food cravings and flavors around that, like sweets or things of that nature. And also vaping with nicotine can suppress appetite. So if it is intended for a particular weight loss purpose, that can actually reduce some of your appetite and, curtail the food intake you have, therefore potentially meeting a goal of losing weight or just adjusting caloric intake. And then I've done other research around college students as well, looking at people who are either diagnosed with an eating disorder in their lifetime or at higher risk, are more likely to use a variety of illicit drugs like marijuana or cocaine, methamphetamine, stimulants, et cetera. And again, the sort of ideas here between the eating disorders and drug use, similar to vaping, could be around like appetite suppressants, or even just a general, experience around emotion dysregulation, challenges managing emotions. And so obviously substance use can be a really effective way, along with eating disorders, to manage that. And then lastly, like you mentioned, non-suicidal self-injury. So things like cutting or headbanging or hurting yourself in some intentional way without the purpose of death, and suicidal ideation. So that specifically focused on college men. And so those who engage in non-suicidal self-injury and suicidal ideation were more likely to be screening positive for eating disorder, having higher risk of an eating disorder. So again, filling important gaps. Like, we didn't really know a lot about relationships between non-suicidal self-injury and suicidal ideation among men. And so that sort of fills that gap. And we also know that, people with eating disorders are, very commonly attempting suicide or having suicidal thoughts. So it's important to kind of continue to build really, knowledge in that area. And I think the culmination of like those studies, I've done a couple others around people who experience have experienced psychotic symptoms, like hallucinations, have been more likely to experience eating disorders. I mean, it all kind of just paints the picture of these issues being very complex. Disordered eating and eating disorders are multifaceted. They're, most people who like walk in the door or experience the eating disorder are not just experiencing that one thing. Like, they're not just restricting their food or binging and purging or just binging. Like, they are engaged, they are, experiencing a plethora of complex, issues, and that could be substance use, it could be psychosis, it could be depression, it could be suicidal behavior. And so there's a lot of complexity there, and we need to be not only assessing and treating these issues with that in mind, but also, of course, doing research that focuses on how do we identify these problems, how do we gather a better picture of them, how do we understand them more clearly, which then, of course, would lead to all types of other, again, prevention and intervention efforts.
Kyle, thank you so much for sharing all this, and best of luck with your further research. Thank you.
Yeah, thank you. I appreciate it.